Did you know that by the time you finish watching this video, around 20 older adults in the U.S. will have been diagnosed with dementia? That's one person every 66 seconds. Most people assume it is just a part of getting older. But what if that's not the full story? What if the real trigger isn't age, but the pills sitting quietly in your medicine cabinet? Every day, millions of seniors take medications for sleep, allergies, heartburn, pain, even bladder control, believing they're harmless. But new research shows that some of these common drugs may quietly be affecting memory, shrinking key areas of the brain, and increasing the risk of dementia without any warning label to tell you, this video isn't here to scare you. It's here to give you clarity and maybe a little peace of mind. Because when you understand what's happening in your body, you can take steps to protect it. I'm not a doctor. I'm just someone who cares enough to share what I've learned, like a friend who tells you what they wish someone had told them sooner. If anything here feels familiar or makes you pause, share your thoughts in the comments. You might help someone else feel seen. And if you'd like more gentle, science-based health insights like this, feel free to subscribe to Healthy Cramps. We're not selling products, we're giving perspective. Sometimes, that's all it takes to change a future. You ever walk into a room and forget why you came in? Or maybe you've misplaced your keys. Again, even though you swore they were right there. Most people laugh it off. Just getting older. They say, but here's the thing, what if it's not just age, mild brain fog, forgetfulness, losing track of conversations? These can be early signs that something deeper is going on. And more importantly, they might be reversible. Recent studies are now linking specific medications to these symptoms, not in vague, indirect ways, but through measurable changes in brain function, memory loss, and even structural shrinkage in key brain regions. This isn't about fear, it's about recognition. Because when you know what's really causing it, you can do something about it. So if you've ever felt off lately, this next part might hit close to home. And now, no more delays. Let's start our list of the 9 most brain-disrupting medications. First up, diphenhydramine, more commonly known as Benadryl. It's that little pink pill many of us have used for allergies, sleep, or a cold. It's cheap, easy to get over the counter, and feels harmless. But here's what most people don't know. Diphenhydramine belongs to a group of drugs called anticholinergics. These drugs block acetylcholine, a brain chemical that helps form memories and keeps your mind sharp. And when you're older, you need every bit of acetylcholine you've got. A 2023 study found that seniors who used anticholinergic drugs regularly had a 54% higher risk of developing dementia. That's not small. That's significant. So next time you see the label with PM, nighttime, or allergy relief, double. Check if diphenhydramine is inside. It might not be worth the foggy mornings. Coming up next, another everyday medication. But this one doesn't touch your brain directly. It blocks what your brain needs to stay healthy. Now let's talk about proton pump inhibitors, or PPIs for short. You might know them as Prilosec or Nexium, commonly used to treat acid reflux and heartburn. They work by reducing stomach acid. But here's what they don't tell you. Stomach acid is also how your body absorbs vitamin B12, magnesium, and calcium, nutrients that are vital for brain health. Without them, your neurons can't communicate properly. That's when things like memory slips, brain fog, and confusion start creeping in. In fact, a study of over 73,000 adults found that long-term PPI users had a 44% increased risk of dementia. So if you've been on PPIs for more than a few months, it's worth asking your doctor whether you really need them and whether there's a safer alternative, like H2 blockers or natural remedies. Still with me? Great. Because what's coming next affects something most of us don't talk about, but it can quietly break down both memory and emotional balance. Next on our list is a medication many seniors take quietly, without question. Oxybutynin, often sold under the name Ditropan. If you're using it to control an overactive bladder or incontinence, you're not alone. And yes, those symptoms can be frustrating, even embarrassing. But what's rarely discussed is what oxybutynin does to your brain. It's another strong anticholinergic, and unlike milder drugs, this one crosses the blood-brain barrier. That means it has direct access to memory centers like the hippocampus, the part of your brain that holds on to new information. A study from 2019 found that seniors over 65 who took oxybutynin for more than a year had a 49% higher risk of developing dementia. And the scary part, most were never told. They just started feeling foggy, missing appointments, or feeling like they were not quite themselves. But don't worry, there's a safer option. Let's talk about that next. Here's the good news. For every risky drug on this list, there's usually a safer alternative. And when it comes to bladder control, one of the better ones is mirabegron, sold under the brand name Mirbatric. Unlike oxybutynin, mirabegron works through a completely different pathway. It doesn't block acetylcholine, and it's far less likely to interfere with memory or mood. It helps relax the bladder muscles, reducing those urgent bathroom trips without the brain fog that often comes with older medications. Of course, no drug is perfect, and every person reacts differently. But the key is knowing you have options and bringing those options into the conversation with your doctor. If you've been on oxybutynin and you've noticed changes in your focus, memory, or mood, don't ignore it. It might not be just aging. It might be chemical. And speaking of misunderstood medications, the next one is prescribed by millions of doctors every year, and yet, it may be quietly starving your brain. Let's move on. Now, let's talk about statins, one of the most prescribed drug classes in the world, especially for people over 60. These include simvastatin Zocor and atorvastatin Lipitor. They're designed to lower cholesterol, which helps reduce the risk of heart attacks and strokes. Sounds great, right? But here's something most people don't hear. Cholesterol is also essential for your brain. In fact, your brain is nearly 60% fat, and cholesterol helps build and maintain the myelin sheath, a protective layer around your neurons that helps signals travel smoothly. When cholesterol drops too low, especially over years of statin use, your brain may lose that insulation. That's when memory problems, finding difficulty, and confusion can set in. A 2023 study found that seniors over 70 on statins for more than 3 years had a 26% increased risk of mild cognitive decline. But not all statins are the same. Some are safer than others, and we'll look at that next. Now, just to be clear, not all statins are harmful, but some, especially those that cross the blood-brain barrier, can affect how your brain functions over time. Why? Because when they aggressively lower cholesterol, they can also reduce the raw materials your brain needs to stay sharp. Think of cholesterol like insulation on electrical wires. It protects the brain's communication pathways. Without enough of it, those pathways fray, and signals don't travel as well. You might start forgetting names, misplacing words, or getting confused more often. The 2023 study I mentioned earlier, it showed that high-dose, long-term statin users had more noticeable memory decline than those on lower doses or different types. But here's what's important. Not all statins cross into the brain. Some are much cleaner in that sense, like pravastatin or rosuvastatin. So let's talk about what to do if you're on statins, but also worried about your memory. If you're taking statins and you've noticed brain fog, slower thinking, or even personality shifts, it might be time to check which statin you're on. Some, like simvastatin and atorvastatin, easily enter the brain. Others, like pravastatin and rosuvastatin Crestor, do not and may pose less risk to cognitive function. This doesn't mean you should stop taking your statin. Never stop any medication abruptly. But it does mean you have options. And the best place to start is a simple, honest conversation with your doctor. I've been reading about how some statins affect memory. Would it make sense to review my medication or try an alternative? It's not about rejecting treatment. It's about finding the safest version for you. Now, we've talked about pills that sneak into your brain. But the next one, it acts more like a sedative trap, one that's incredibly hard to escape once you're in. Let's talk about 5 on our list. Next up, benzodiazepines, often called benzos. Names you might recognize include Xanax, Valium, or Ativan, prescribed for anxiety, panic, or trouble sleeping. At first, these drugs feel like lifesavers. They calm racing thoughts, help you sleep, and take the edge off overwhelming emotions. But over time, they can become something else entirely, a chemical fog. Benzos work by enhancing GABA, the brain's calming neurotransmitter. That sounds helpful, but when the brain is constantly sedated, it stops learning efficiently. You become less sharp, less emotionally connected, and more vulnerable to memory loss. A 2022 study in the BMJ followed over 8 1,000 seniors for 6 years. Those who used benzos for more than 3 months had a 51% increased risk of developing Alzheimer's disease. And worst of all, they're hard to quit because withdrawal symptoms can mimic the very issues they were prescribed for. But there are ways to safely transition off benzos. We'll cover that next. Here's where things get tricky. Benzodiazepines, like Xanax or Ativan, don't just sedate your brain, they train it to rely on them. Over time, your brain starts producing less of its own calming chemicals because it's getting them from the pill. Then what happens? You stop taking it and suddenly, anxiety comes back. Hard. Sleep gets worse. Your body goes into panic mode. But here's the twist. It's not your original problem coming back, it's withdrawal. So you take another pill, and the loop continues. Many seniors describe this as feeling disconnected or not themselves. Their loved ones notice it too, subtle personality changes, fogginess, or emotional flatness that slowly builds up over time. And this isn't rare. Benzos are still being prescribed to older adults every day, even though experts strongly warn against long-term use in seniors. But the good news, there are safer ways to manage anxiety and sleep. Let's walk through them. Getting off benzos doesn't have to be scary, but it must be done safely. First things first, never stop abruptly. Quitting cold turkey can trigger severe symptoms like seizures or panic attacks. Instead, work with your doctor to gradually taper down, week by week. Now, for alternatives. For anxiety, a non-sedating option called buspirone has shown to be effective for many people without the same cognitive risks. For sleep, CBT, cognitive behavioral therapy for insomnia is now considered the gold standard. It's a drug-free approach that helps you rebuild a natural, healthy sleep cycle. Some people also find relief through low-dose melatonin, magnesium glycinate, or calming routines like meditation and gentle stretching at night. Remember, the goal isn't just to remove a pill, it's to replace it with tools that support both your mind and body. Now that we've covered anxiety and sleep meds, let's move on to a drug that seems innocent, but has one of the strongest cognitive side effects of all. Next on our list is amitriptyline. Often sold as Elavil, it's an older antidepressant that's still commonly prescribed today, not just for mood, but for chronic pain, migraines, and insomnia. A true multitasker, or so it seems. But behind the scenes, amitriptyline is one of the most potent anticholinergic drugs still in use. That means it interferes strongly with acetylcholine, the neurotransmitter your brain needs for memory and focus. In a massive 2015 study of over 400 adults aged 65 plus, those who used drugs like amitriptyline over a 10-year period had a 54% higher chance of developing dementia. And what's worse, the decline often happens slowly and silently, disguised as normal aging. People start forgetting small things, having trouble with names, or feeling mentally fuzzy, without realizing their medication may be the cause. The upside, there are newer, gentler options that treat the same issues without hijacking your memory. Let's take a look at those next. If you're taking amitriptyline for pain, sleep, or mood, don't worry. You're not stuck with it. There are safer, modern alternatives that treat the same issues without hijacking your memory. For nerve pain, options like duloxetine Cymbalta or gabapentin can help relieve chronic discomfort with far less anticholinergic effect. If sleep is your main issue, you might consider low-dose doxepin or even melatonin. These support sleep without suppressing memory functions the way amitriptyline does. And when it comes to mood, antidepressants like sertraline or escitalopram have become much more widely used in older adults, precisely because they don't carry the same cognitive risks. Here's the point. You don't need to suffer in silence, and you don't need to trade your memory for relief. You deserve both. And now, we move to 3 on our list, a medication that's prescribed millions of times each year, but has one major difference from other antidepressants. And it's not a good one. Coming in at number 3 is paroxetine, often sold under the brand name Paxil. It belongs to a class of antidepressants called SSRIs, selective serotonin reuptake inhibitors. Most SSRIs are considered safe for older adults, but paroxetine is the exception. It's the only SSRI with strong anticholinergic properties. That means, just like Benadryl or amitriptyline, it interferes with acetylcholine, the brain chemical responsible for memory, learning, and mental clarity. In a 2021 review published in Frontiers in Psychiatry, seniors on paroxetine showed measurable declines in short-term memory, verbal recall, and attention span, often within the first year. And yet, it's still widely prescribed. Why? Sometimes doctors don't realize the cognitive risk. Other times, it's just the default in a system that hasn't caught up to newer research. But you're not powerless. There are better options, and we'll explore them next. If you're currently on paroxetine, take a deep breath. There's no need to panic, but there is a reason to check in with your doctor. Because while paroxetine may work for anxiety or depression, other SSRIs can do the same job with fewer risks to your brain. Two of the safest and most common options are sertraline Zoloft and escitalopram Lexapro. Both have minimal anticholinergic activity, and they're generally well tolerated in older adults. Even more, combining these with vitamin support, especially B6 and B12, can further help with mood regulation and brain health. What matters most is this: you don't have to sacrifice your memory to feel emotionally well. You can have both, and you should ask for both. Now, the next medication on our list is even more alarming because many seniors take it without knowing what it actually is. Let's move on to 2. Number 2 on our list is a group of drugs called antipsychotics. You might know them as quetiapine Seroquel, risperidone Risperdal, or olanzapine Zyprexa. Originally, these medications were developed to treat serious mental illnesses like schizophrenia or bipolar disorder. But today, they're often used off-label in seniors to manage sleep problems, restlessness, or behavioral changes, especially in dementia patients. And that's where the danger lies. Antipsychotics suppress dopamine, a chemical linked to motivation, memory, and emotional balance. The result? A brain that becomes sluggish, disconnected, and unresponsive. In a 2022 study published in The Lancet Healthy Longevity, seniors prescribed antipsychotics for behavioral symptoms had a 71% higher risk of worsening cognitive decline within just 12 months. Many families don't even realize their loved one is on one of these drugs until their personality fades right before their eyes. So, what can you do if this sounds familiar? Let's talk options. When seniors become confused, agitated, or hard to manage, it's understandable that caregivers want to help them calm down, but sedation is not the same as support. Antipsychotics don't fix the root issue. They mask it by flattening emotions, dulling alertness, and slowing thought. That might make someone easier to care for, but it also means they're no longer truly present. The worst part, these medications also increase the risk of falls, strokes, and even sudden death in older adults. So what are the alternatives? Often, the answer lies in non-drug interventions, creating calm routines, managing pain or discomfort, adjusting lighting, noise, or daily structure. In more severe cases, lower doses for short periods may be justified, but they should never be a default. You have the right to ask questions and the right to protect your loved one's mind. But what happens when multiple medications, not just one, start piling on harm? That's where we arrive at the most dangerous item on this list. The one most dangerous medication isn't a single drug. It's the hidden combination of multiple drugs that each carry anticholinergic effects. This is called anticholinergic polypharmacy, and it's incredibly common in seniors. Picture this. You take Benadryl to sleep, oxybutynin for your bladder, and amitriptyline for pain. Each one alone might only slightly affect your memory. But together, they create a chemical storm that your brain can't keep up with. In a 2022 analysis of over 280,000 older adults, those with the highest anticholinergic burden had a 120% higher risk of developing dementia within 10 years. Even worse, most people have no idea their medications overlap like this because no one ever sat down to add them up. This doesn't require panic. It requires clarity. So in the next part, I'll show you exactly how to check your own medication list and what to ask your doctor. So now you might be wondering, how do I know if I'm dealing with anticholinergic overload? The first step is simple, but powerful. Make a complete list of everything you're taking. Not just prescriptions, include over the counter meds and supplements. 2. You'd be surprised how many common allergy or sleep aids contain hidden anticholinergics. Once you've got your list, Ask your doctor or pharmacist to review it for what's called anticholinergic burden. There are even online tools and scoring systems that can help calculate your total risk. You don't need to memorize every drug name or chemical class. That's your care team's job. Your job is to bring it up. Ask. Advocate for your brain. And if you're not sure how to start that conversation, don't worry. I've got a simple script you can use. We'll go over it next. Talking to your doctor about medication can feel intimidating, but it doesn't have to be. Here's one way to begin. I recently learned about anticholinergic medications and how they can affect memory, especially in older adults. Can we review my current meds to see if any might be contributing? That's it. You're not blaming anyone. You're just opening the door to a smarter, safer discussion. If your doctor seems unsure, ask to consult with a geriatric pharmacist, someone who specializes in how meds affect aging brains. You can also say, I want to stay sharp and independent as I age. If there's a safer version of something I'm taking, I'd love to explore that. It's not about quitting everything, it's about choosing wisely. And the beautiful part, when the anticholinergic burden is reduced, many people experience clearer thinking in just weeks or months. Let's take a quick look at what that recovery can feel like. Here's the best part of all this. Drug-induced memory problems are often reversible. When seniors reduce their anticholinergic load, either by stopping or switching medications, many report clearer thinking, better focus, and more energy within just a few weeks. Why? Because your brain is more resilient than you've been told. When you lift the chemical fog, it can start to reconnect, repair, and re-engage with the world. People often say things like, it feels like I woke up again. I'm remembering names, appointments, and where I left my phone. I feel more like myself. And that's exactly the point. You're not just saving your memory. You're preserving your identity, the part of you that tells jokes, makes decisions, remembers birthdays, and connects with the people you love. Now that we've covered all 9 medications and the silent stacking effect, let's bring it all together in a quick recap before we wrap up. We've covered a lot. So let's take a moment to bring it all together. Here's a quick recap of the 9 most common medications linked to memory problems and increased dementia risk in older adults. You don't have to memorize every detail, but even knowing these names can spark the right conversation with your doctor. Let's count them down, starting from the ones most often overlooked. 9. Diphenhydramine Benadryl, used for sleep or allergies. 8. Proton pump inhibitors, Prilosec. Nexium, used for heartburn. 7. Oxybutynin ditropan, used for bladder control. Each one serves a real need, but the way they affect the brain, especially over time, is what we need to pay attention to. Next, we'll look at the middle of the list. Medications that are widely prescribed but carry strong anticholinergic or sedative effects. Let's keep going. Now let's continue with the middle of the list. Medications that many people take daily, sometimes for years, without realizing their effect on the brain. 6. Statins, simvastatin. Atorvastatin, for lowering cholesterol. While not all statins are risky, certain types can cross the blood-brain barrier and interfere with nerve signaling. 5. Benzodiazepines, Xanax. Valium, Ativan, for anxiety and sleep. These can slowly dull your brain's ability to learn, remember, and react, and they're notoriously hard to stop. 4. Amitriptyline, Elavil, for pain, sleep, or migraines. One of the strongest anticholinergics still in use today, especially risky for long-term cognitive health. If any of these sound familiar, don't panic. Just take note. We've got 3 more to go, and these next ones are often misunderstood, misused, or hidden in plain sight. Let's wrap up the list and talk about what really makes one the most dangerous of all. Here's the final stretch of our list, the last 3 medications that deserve your attention. 3. Paroxetine Paxil, an antidepressant. SSRI with unexpected anticholinergic effects. Unlike other SSRIs, this one interferes with memory and attention, especially in older adults. 2. Antipsychotic Seroquel. Risperdal. Zyprexa, sometimes prescribed off-label for sleep or behavior. These can flatten personality, slow thinking, and raise risk of stroke or rapid decline. And finally, 1. Anticholinergic polypharmacy, the silent stacking of multiple medications with overlapping effects. This one is sneaky, because it's not one pill, it's the combination that leads to overwhelming risk. What matters most is not fear, but awareness. If you recognized even one name on this list, that's a great first step. And remember, the goal here isn't to make you toss your meds, it's to give you the knowledge to have better conversations. In the next part, we'll tie it all together with one big takeaway and a few small steps you can take starting today. Let's pause for a second and zoom out. If you've been following this list and thinking, I've taken some of these, or my parents are on a few, that's okay. This isn't about guilt, and it's definitely not about fear. It's about clarity, because now you know what most people don't. That common medications can impact memory, that certain combinations multiply the risk, and that you actually have choices. The goal of this video isn't to make you question every pill, but to equip you with the right questions to ask. And that alone, it's powerful. You don't have to be a doctor to protect your brain. You just have to be someone who pays attention and speaks up. Let's talk now about how you can take the first steps to protect yourself or a loved one, starting today. Here are 3 small but powerful steps you can take this week to reduce your risk and take back control. Step 1. Make a list of everything you're taking. Prescriptions, over the counter meds, supplements, write it all down. Every pill, every day. Step 2. Ask your doctor or pharmacist to review the list. Say, can you check for any anticholinergic effects or interactions that might affect memory? You don't need to explain everything. Just ask the question. Step 3. Explore safer alternatives. If a certain medication is flagged, ask if there's a newer or lower risk version. You're not demanding, just collaborating. You can even bring this video summary to your next appointment. Because when it comes to protecting your memory, you don't need to do everything at once. Just one step at a time with the right information can make a big difference. In fact, many people who made small changes saw big results. Let's take a look. One of the most hopeful parts of this journey, hearing from people who've already made the change. Here's what a few of them have shared. After switching off just one medication, the brain fog started lifting within 2 weeks. I feel like myself again. I'm sharper, more engaged with my grandkids, and not so tired all the time. I thought I was just getting old. Turns out, it was the meds. These aren't miracle stories. They're just real people who got curious, asked questions, and made thoughtful changes with the help of their doctors. It's not about rejecting medication. It's about understanding how it works and how to make it work for you, not against you. You deserve to feel clear, present, and in control of your health. And now that you know what to look for, you're already ahead of the game. Let's wrap up with one final thought and a gentle invitation if this video helped you. If there's one thing I hope you take from this video, it's this. Your memory is not something you just have to lose. Yes, aging brings changes. Yes, medications can be helpful. But clarity, focus, and independence aren't luxuries. They're part of a life well lived. And the truth is, so much of what feels like getting older might actually be something you can change. Not overnight, not all at once, but step by step with information, support, and the courage to speak up. You've now seen the 9 medications that matter. You've learned what to ask, what to look for, and where the hidden risks might be. The next move, it's yours. And it doesn't have to be dramatic. Just talk to your doctor. Share this info. Start the conversation. Because protecting your brain doesn't start with fear. It starts with awareness and a little bit of hope. At the end of the day, this isn't about medications. It's about you and the version of you that's still curious, still capable, and still in charge of your health. You deserve to stay sharp. You deserve to wake up clear, minded, to remember birthdays, to tell your stories, to feel like you. And if even one part of this video helped you pause, reflect, or ask a better question, then you're already doing the most important thing. You're paying attention. If this kind of honest, science-backed, no, pressure health talk is something you'd like more of, I invite you to subscribe to this channel, Healthy Cramps. Here, we don't sell magic pills. We share real conversations about aging, clarity, and how to protect the life you've built. Because sometimes, all it takes is one small shift in awareness to change everything about how you move forward. You're not behind. You're just beginning with better tools. And we'll be right here with you.